Oh, there's a little feedback, Avery. On I think your end, I can hear a lot of feedback there. That's better. So my name is Shelbey Mitchell. I am the Columbus State, Delaware mental health clinician. So I've been with Columbus State since last summer at the Delaware campus. And so it's a newer program, but we're super excited and have some, we've really grown a lot over the last year. And I think that we see a lot of students really needing some support. So it's awesome to be able to provide this for students. So as Avery said, if you guys have any questions throughout the presentation, feel free to type them in the chat. Avery will be monitoring that, and I'm more than happy to stop. I want this to be as interactive as possible. And if you would prefer to just unmute yourself, go for that. But if you guys have any questions, please don't hesitate to ask. So we're going to get started with a little bit of a poll, and then we have just kind of a quick run through of mental health, mental illness, stress, coping, things like that. And then at the end, we'll do a Q&A. So I'll answer any questions that you might have, whether it's related to mental health generally, whether it's just related to school stress or what our program offers, what resources there are on campus for support. We're willing, I'm willing to answer any questions that I'm able to. And so feel free to pass those along. So I'm going to go ahead and share my screen. We will get started. So for this first activity, you're going to need your phones. And what you're going to do is, it's like a little bit of a quiz. And so you're going to go ahead and text Tori Trimble, so Tory Trimble, TRIMBLE 700 to 37607. And then, so for this first question, mental health refers to A, achieving a period of 12 to 18 months without a psychotic episode, B, striking a balance in all aspects of your life, social, physical, spiritual, economic, and mental, C, a constant feeling of contentment, or D, a lack of mental illness. So go ahead and text your answers. You can just text A, B, C, or D, and it should be able to pop up with all of what everybody has texted or answered. I hope it's working. Avery, are you able to text it and see if it's working?
Yeah, I just sent in my answer.
Okay. Let me try and activate it again and make sure it's going okay. Try again. I don't know why the answers are not popping up. It says total results too, so, oh, yeah, show responses. Sorry, guys.
There we go.
All right, so we have 2 people responded with B. Let's see. Yes. All right. So it is striking a balance in all aspects of your life. And that's super important. We want to keep that in mind because like down here, it says a lack of mental illness. That is usually one that can kind of trip people up because, oh, well, I don't have a mental illness. So then that means that my mental health is good. And that's not necessarily what that refers to. You can still not necessarily have a diagnosable mental illness, but actually not have great mental health. So all right, let's move on to the next one. Okay, so it's not depression, you're just going through a tough phase. This is one that I hear quite frequently working with adolescents, college students, pretty much it's a societal expectation. So true or false, if you're having depressive symptoms, it's not depression, you're just going through a tough phase. Okay. Obviously false, right? When it comes to depression, Yes, you very well might be having some depressive symptoms when you're going through something really, really difficult. That is definitely bound to happen. But there are specific criteria that we look at as counselors to qualify somebody as having depression. And so it's very specific, and you have to hit this certain criteria. So if you are having specific depressive symptoms that are consistent with a depressive episode, that's not just going through a tough phase. And I think what is something we need to keep in mind about that is a depressive episode, it only takes 2 weeks to be diagnosed with a depressive episode. So it's pretty short, and really something that I think is pretty eye-opening, because it could be this 2-week depressive episode, and then, something that you can get better as long as you're coping okay. So just making sure we're looking at this and we have the right perception. All right. How can you cope with mental illness symptoms? Sorry, my language a little off there. How can you cope with mental illness symptoms? Wait it out, avoid those feelings, or use distress tolerance skills? All right. Correct answer. C, use distress tolerance skills. And with that, the reason that I kind of added all of those in there is because avoiding our feelings or avoiding triggers can usually be something that we use as a way to cope. And unfortunately, I kind of describe it as like if you were to just stand there and hold your arm out and just let it sit there, after a while, it's going to get really tired, right? And so we really need to make sure that we're taking care of things. Using distress tolerance skills is a really awesome way to cope with symptoms of a mental illness. And we can talk a little bit more about what distress tolerance skills are. But generally, we don't want to avoid those feelings because they're not going anywhere. And so if we do avoid them, they pile up. We start to feel even more stressed because it's even, more overwhelming and anxiety provoking because we're not going to just get rid of them completely. So we really want to make sure that we're using those distress tolerance skills. So what is the best way to manage negative thinking? Just think positively, try and find evidence for your thought, or push the thought away. Alrighty. I like the variation of answers we're getting now because these are starting to get a little bit tougher. So generally, when we try to go the route of just thinking positively, our brain is going to reject it because we don't see that as realistic. And so if you're having a negative thought or you're feeling really down, just trying to switch your thought to think positively oftentimes isn't going to work because it's our brain is saying, but that doesn't feel like how I'm feeling right now. And so most of the time our brain tries to go with something that makes sense, something that's realistic. And so really what we want to do is try and find evidence for our thought, for our negative thought. So if you're having a negative thought, such as somebody's mad at me, we've all had something like that before, or I'm going to do really bad on this test. If we really stop and try and find the evidence for what we're thinking, it actually helps our brain to respond better to it. So making sure that we're trying to find specific evidence for our thought rather than just trying to be falsely positive all the time. What is the average, this one's tough, what is the average delay between the onset of mental health symptoms and intervention? Oh, I should probably do the shift responses. All right. 10 plus years. And that is really concerning. Actually, the average delay is 11 years, what we found. So 11 years from when you first start showing symptoms to when you actually start getting treatment. And so if we were thinking about that, it's like, as a young child, maybe 7 or 8 years old, you start exhibiting symptoms of a mental illness. Usually that person is not getting help until they're, in their late teens. So that's a long time. And what we know is the earlier intervention, the better outcome. And so we really want to make sure that if we are exhibiting mental health symptoms, that we are taking care of it right away, right? Otherwise, it becomes unmanageable. And oftentimes people avoid that because there's too much going on, or they're already stressed out as it is, or time management is really difficult. And those are all things that, we experience from time to time. But if it's not taken care of, it just continues to get worse. Okay. Suicide is what leading cause of death among college students? What number? Right. Correct answer. Second. So the first leading cause of death is actually accidents, just general accidents. And I think what's really hard about that is the coroners will not disclose if something was a suicide unless there was very clear signs that that was what happened. Usually there has to be some sort of note or some previous mention of having suicidal ideation. But generally, if it was an overdose, for instance, that will not be ruled a suicide unless it was a specific laid out plan. So that would be ruled an accident. So there might be a lot more deaths among college students that are actual suicides, but we don't know about that. All right. That is it. So hold on, I'm going to stop presenting so that I can reshare and get to a different screen. Do you guys have any questions about that little poll thus far?
I don't see any questions in the chat.
Okay, cool. I'm going to go ahead and switch over here. All right, so just in general, we're just going to have a super quick little educational PowerPoint on what is mental health. What does that look like for college students? What should we keep an eye out for? Really, how does the stress of school impact college students? All super, super important. So, oh, sorry, I gotta figure out. Okay, so what is mental health? Similarly to what we already discussed from the poll, mental health refers to the maintenance of successful mental activity. So maintaining your daily activities, maintaining fulfilling relationships, ability to adapt to change and be flexible and cope with stress. And generally, we don't look, as counselors, we don't look at mental health or mental illness and say that somebody is functioning perfectly fine in their life. It's really hard to diagnose somebody with a mental illness in that instance because generally we look at it and say, how is this thing impacting your life? And a lot of times people feel like things are going really well, but then you dig a little bit deeper and there's a lot more. So again, like I stated before, mental health is not simply the absence of mental illness. It's a little bit more. We have to be qualifying that as I'm actually being productive. I actually feel good in all of these areas of my life, not just, oh, hey, I don't have a diagnosable mental illness. So mental illness in college is very, very prevalent. It is something that really needs to be talked about more. It's really important that we get the word out there about how serious it is. So 40% of college students in 2018 were diagnosed with a depressive episode. That is the number one reason that students drop out of school. And if it's left untreated, it can lead to some suicidal ideation. And so that's a pretty significant number. That's a lot of people when we're thinking about that. And this is not updated with like anxiety. I was thinking anxiety specifically. These stats are not updated with like 2020 because obviously we don't have numbers for that yet, but they are finding that anxiety has increased significantly since the pandemic has started. So that is something that, you know, we want to keep in mind. But 40 million adults over the age of 18 are diagnosed with anxiety. So 75% of the first episode begins before the age of 22. So that's pretty young. And a lot of times we mistake what that looks like. So we think like, oh, I'm just feeling a little bit of stress. The stress is normal. Or, you know, I'm feeling a little anxious, but everybody feels anxiety. And while, yes, that is true that everybody feels anxiety, having an anxiety episode is different than just feeling anxious from time to time or being nervous about going into a test or some, you know, really big activity that you have going on. So we want to make sure to know the difference. Suicide, again, the second leading cause of death among college students. So 10% of college students have had thoughts or made a plan to die by suicide, and 1,000 suicidal deaths on college campuses every year. So that's pretty significant. And again, we want to make sure that we're paying attention also to know like what to look for in friends and how to support them. Eating disorders, 95% of those with an eating disorder, 95% of those with eating disorders are between the ages of 12 to 25. So that is pretty significant. We often think about eating disorders as something that comes out of like control, right? Well, I feel very out of control, so I want to be able to control what I do with my body. And oftentimes having that mentality is really damaging because that is not correct. Eating disorders are very biological. So if you know of anybody in your family that has an eating disorder, we want to make sure that we're keeping that in mind, similarly to substance abuse, because we are at a higher predisposition to be likely to be diagnosed with an eating disorder because of somebody in our family having an eating disorder. So we want to be mindful of that. And I think what makes it really difficult is our society has this expectation of dieting culture, right? Like, well, I'm on a diet right now, or I need to lose weight. And so because of that, we really ignore a lot of problematic behaviors that are surrounding eating and just, you know, what we're eating on a day-to-day basis. So recognizing the signs that if we are having some problematic behaviors, asking ourselves the question, could it be something more? Could it be an eating disorder? And then substance abuse. So about 80% of college students drink, and 50% of those are binge drinkers, with 1,825 ages 18 to 24 dying from alcohol-related deaths annually. So again, pretty significant number. And we really want to make sure that we're getting some healthy practices regarding substance use and drinking out there. All right, so supporting the mental health of our college students. So more than 40% of college students have felt more than an average amount of stress within the past 12 months. 80% have felt overwhelmed by all they had to do, and 45% felt like things were hopeless. 64% of young adults who are no longer in college report that it's related to a mental health related reason. That's pretty significant. So a majority of people that have dropped out of school are doing so because of mental illness or because of a mental health related reason. So it's important that we're getting information out here and that we're taking care of ourselves, because if we're not, it does lead to, you know, dropping out of school and potentially not taking the goal or hitting the goals that we were anticipating. And so a lot of times people say, like I described, a lot of times people say, oh, I'll just deal with that later, or I need to get through this week, and then, you know, I'll have plenty of time, or I need to get through this semester, and then I'll take care of my mental health. Well, not recognizing that your mental health is directly related to how well you're doing in school. So making sure we're taking care of that earlier on. And more than 45% of young adults who stopped attending college because of mental health related reasons did not request accommodations. 50% of them did not access mental health services or supports. So of the students that are struggling in college, most of them are not reaching out for help. And we need to change that, right? So a few things to keep in mind just with regards to some basic mental illnesses. I'm kind of going to go over some myths because a lot of times I hear these all the time. So depression is not real, it's just sadness, or it's just you're going through a tough time. And that's not true at all. We know that depression is an illness with a biological basis. And so if we look down there at that, the brain scans, so a normal brain and a depressed brain, very, very different. And so we want to recognize that this is an issue of the brain, right? This is related to brain chemistry, to the neurological pathways in the brain. And so we want to take that as seriously as we would take a physical illness, right? So being happy or sad in response to disappointment is very normal. But many people use that term, oh, I'm so depressed, right? I hear that a lot. And when we use those words, we're really not taking into consideration what depression actually is. And if you do feel seriously depressed, well, then we need to take that as it is, right? For if it is depression, we need to do something about it and get treatment. And then nervousness or worry and anxiety disorders are not one and the same. So again, we all feel nervous when it comes to big situations or life changes. Those are totally normal. But with anxiety, we look at a period of 6 months, right? So if you have been having anxiety symptoms for about 6 months, then, and it has to be present in multiple areas of your life. So if it is just related to school, it's more than likely not an anxiety disorder. And we want to see if it's present in multiple areas as well as impairing your ability to function. So that means that it could be more of like a diagnosable anxiety disorder. And then similarly to the depression, if we look down here at these brain scans, again, very different. We recognize that areas of our brain, when we feel anxious or we have an anxiety disorder, somebody that has an anxiety disorder versus somebody that doesn't, different parts of their brain light up. For instance, the amygdala, which is the fear center of our brain. So that center of your brain is lighting up and it's on overdrive constantly without there even being anything that is stressing you out. So very, very different than just I feel anxious or I feel worried from time to time or I'm nervous. A couple more here. So OCD, I hear a lot of things about OCD, just simply like, oh, I like to be really organized or I'm very clean. And so kind of dispelling some myths. OCD is a lot more serious than that. It requires us to have some obsessions, so those unwanted impulses or thoughts, as well as the compulsions, which is you have to do this thing or something bad will happen. So usually the compulsions are following these obsessions as a way to get rid of the anxiety that comes along with the obsession. So it just is it's an attempt to protect themselves. It's a survival mechanism. Usually someone with OCD understands that what is happening is irrational, and they don't really want to engage in whatever, compulsion they're having, but they cannot help it. And then ADHD, I think, this is one that is very, very hot right now, very overdiagnosed. So if we just simply can't focus, we usually try to say that we have ADHD, or oftentimes people used to refer to it as ADD. It's all ADHD. And so we all daydream. We all struggle to focus because if we're bored or tired, our brain requires there to be something like novel and exciting to reel us back in. So it's normal to daydream, but if you're recognizing that you're having a difficulty focusing or you're having hyperactivity in multiple settings, then it's impacting your ability to function, then it might be something more. And generally, you're not going to get an ADHD diagnosis from a therapist. Usually you have to go through some testing, and it has to be from like a psychologist, or a doctor. So we, take that pretty seriously because it is diagnosed a lot. And then bipolar disorder, I hear this one quite frequently too, like somebody saying, well, I have mood swings, or I'm happy one second and I'm sad the next, like I'm so bipolar. And there is a very specific criteria that needs to be met for mania or hypomania, as well as major depressive disorder, in order for somebody to be diagnosed with bipolar disorder. It's very, very serious. It is not a mental illness to be taken lightly. It is not something to be thrown around out there. So we want to make sure that we're, taking that as serious as it is. So when the brain is not working properly, as we've said through this presentation so far, this is usually a disorder of the brain. And so one of our 6 functions will be disrupted: our thinking, our perception, our emotions, the signaling, our physical symptoms, or behavioral symptoms. And so that can include difficulties thinking or problems with focusing, or even when we're talking about like the perceptions and thinking area of it, some of those negative thoughts that we talked about, some extreme emotional highs and lows, as well as some sleep problems. What causes mental illness? The answer is there is no one cause. It is very complicated. And so while we know that the exact source of mental illnesses is not known, a lot of research suggests basically that it's genetics, biology, the psychosocial, so your environment, and just a general the way that your brain might be structured. And so all of those things need to be taken into consideration. And I think what's really difficult too is a lot of times people like to say, well, I have depression, or I don't know, for instance, I had a substance use disorder, and so I know that this is something that people can do to get out of it. It's not that simple, and everybody is so different. Everybody is so unique, and we have to take into consideration that everybody's brains are different, and everybody's environment is different. And I think that it's super interesting. There are case studies with 2 people in the same family, and they go through almost the exact same situation and deal with it totally differently, right? So there is just no one way to look at this stuff. There are so many different potential causes. So how does this affect college students? There was a study that was done by NYU, and basically the demands of school lead to high levels of chronic stress. That chronic stress leads to the development of mental health concerns, although that is not the only reason, as we just discussed. And so the NYU study found that college students experience high levels of chronic stress to the point where it impairs their ability to exceed academically, and then compromises their mental health. And so most mental illnesses develop between the ages of 18 to 25. And I always ask this question when I'm doing this presentation. Why do you think that most mental illnesses develop between that age? What do you think is going on? And you can put your answers in the chat. Or you can unmute yourself and guess. Any guesses at all? What's happening at that age?
Yeah, so I don't know. The people said adulthood, college, education, many are trying to life and full brain development.
Yeah, that is pretty much spot on, right? So we're potentially going to college. You're experiencing significant changes in your everyday life, right? The biggest transition that you're almost ever going to have to go through: leaving home, finding your independence, figuring out who you want to be. It's a big time of like exploring our identity, all while our brains are not fully developed, right? So our brain does not fully develop until our mid to late 20s. And so because of that, our brain is very susceptible to chronic stress and developing mental illness. Oops. There we go. So there are some negative effects of too much stress. Some emotional effects: anxiety, depression, psychological tension, physiological, cognitive, behavioral. I'm not going to go through all of these, but kind of taking a look at those and recognizing maybe in yourself, what are some of your your warning signs that you are experiencing just a little bit too much stress, and at what point do we need to stop and take care of it? And so while knowing that we're breaking it down into those categories, I think is really important because we can look at it from a holistic point. And one of the things I don't really even have on that list, but is like interpersonal concerns. So a lot of times when we're undergoing too much stress, we have some interpersonal concerns, like we start fighting with people a little bit more, or we're quicker to be angry with them. And so it can damage relationships. But keeping all those in mind so that you know your own warning signs when you're experiencing a lot of stress. So excessive stress over a period of time results in the buildup of our stress hormone cortisol. And this stress impairs our ability to do well in school because it impacts our learning and our memory. And so it really impairs the connections that are made in our brain. So not only does stress have a lot of damaging effects emotionally and physiologically, it literally damages your brain if we're experiencing too much stress. So our chronic stress can overwork our body's stress response system, which was not meant to be overworked. Our stress response system was meant to, it was basically there to keep you alive, right? That fight, flight, or freeze mode. And so when we were in fight, flight, or freeze mode, back when we were cavemen, we would, be hunting and then take a nap and take care of yourself, right? That's how our stress response system was meant to be engaged for a short period of time and then relax. But the problem is nowadays we are overworking our stress response system, and it's seriously damaging us for long term. It has long-term effects. And so our brain and our body, they don't know the difference between being in physical danger and like running from a tiger or a bear and just having excess stress from school. So it responds in the same way in both situations. So we want to be really mindful of how we're managing and coping with our stress. Okay. But is all stress bad? No, we know this. Of course not. We have to have a level of stress that is positive. So moderate stress, it's normal, it's beneficial. It's important that we have some moderate levels of stress in our life because it increases our motivation, it increases our survival skills. It actually helps us recognize that we can be resilient and we can be competent at something. So if we're put in a really stressful situation and we get through it and we're okay, we recognize, oh, wow, I did that and I did it well. So maybe I'm really good at this thing. And also recognizing if I get into something like this again, then I can get through this too. So if we're not going through any stressful things in our life, then we actually don't feel any desire to get things done, right? If we never have deadlines, it's like, well, why should I do this thing? So there are some really important reasons that we need stress in our life. So I would encourage you as well to think about maybe some positive stressors that you have and why you need those and how you can keep those positive stressors from turning into too much chronic stress. And so when we're thinking about stress and the brain, we really try to focus on the three main parts of our brain, which is our reptilian brain. That's the part of our brain that regulates our basic functions, our emotional brain, our feelings, basically, and then our thinking brain, which is our rational thought, our planning, problem solving, communication. And so when we're learning in school, obviously we want to be in our thinking brain, right? Problem is when we're too stressed out, we shut off that part of our brain completely, because when we are trying to engage our fight, flight, or freeze mode, when we're in survival mode, again, our brain doesn't know the difference. So when we're in survival mode and we are solely thinking with our reptilian brain and our emotion brain, right? We're scared, we're nervous, we're anxious, and our reptilian brain, those basic functions, they're just trying to make sure that your body stays alive. And so we don't need thinking in that moment. And the problem is when we're taking a test and we're maybe experiencing anxiety or having an anxiety attack, we shut off the part of our brain we need to access in order to do well on that test. So we really want to make sure that we're slowing our brain down, that we're giving, ourselves the ability to cope, so that we can get back to that thinking brain. So now that we know all of that, what do we do with it? It's really, really important that we have a set of skills and strategies. I love this quote over here on the side. So basically, if we had anything else wrong in our body, we would take care of it, right? If your pancreas wasn't working or your kidneys weren't working or you're having stomach pains, you would go to the doctor and do something about it. We would seek treatment. And for some reason, we don't think about the brain as being qualified to be a part of that. So if we're having a mental, mental illness symptoms, that's all part of a brain disorder, basically a chemical imbalance. But oftentimes we hide it, or we ignore it. We just don't want to acknowledge it. And our brain is our most complex organ. It's one of our most vital organs that we have in our body. So we need to make sure that we're treating it just like we would a physical illness. So we have to make sure that we are taking care of ourselves, actively practicing that self-care, and really taking care of ourselves by practicing healthy coping skills. And so we're all going to experience stress, right? That's completely normal. We can't avoid stress completely. It's gonna happen. So it's really important that we have an effective set of coping skills that allows us to maintain our good mental health. And these are just some ideas. So there are some different areas in which we can practice some coping skills. So distraction, ground, emotional release, self-love. I like to say that as like self-compassion, challenging our thoughts, and then accessing our higher self. So these are just some basic ideas, and this is something you can Google. I like this slide a lot because it really gives us pros and cons for each. And one thing we need to remember is one thing that works for, us in one situation might not work in another situation. So we need to have multiple ideas to be able to mix it up, so that we don't feel like we're just trying the same thing over and over and over again if it's not working. And so obviously, like if we're having difficulty with friends, distraction and maybe avoiding it might not be the best way to approach that situation. So we want to find a different way. So making sure that we're approaching situations with what we need in that moment rather than what we're used to having. And then, as always, if students are ever in need, and I messed my phone number up down there, but if they're ever in need of, ongoing support or counseling, I am available for some mental health counseling. I am with the college on Mondays, Wednesdays, and Thursdays. While we're virtual, all of our counseling sessions are done via telehealth. So, video-based counseling, and my email is down there, and then my phone number but it's supposed to be 715-4702. But so if you or anybody might need some extra support, feel free to take down my information, and I'm more than happy to meet with them. But what I'm going to do is stop sharing my screen, and then we'll do Q&A. So feel free to, again, unmute yourself or put your question in the chat, and Avery will ask. So how can I support a friend? I need to figure out how to get to the chat here. How can I support a friend that may be struggling with a mental illness? That's a great question. So that is definitely one that we want to make sure that we're approaching in a very mindful way, and that we're taking, very specific steps to approaching, like supporting a friend, because that is hard. It's not so simple as to just like deal with it, right? We want to make sure that we're approaching it with a friend in a very compassionate way. We're coming from a place of inquisition, recognizing like, hey, like I recognize that you've been, doing this or saying this, and I just really care about you and I'm concerned, rather than a place of attacking and accusing, because that is instantly going to breed defensiveness. So really, it's all about the approach that we use. And then doing something when we're talking about like getting that person help, making sure that we're approaching it in a way that is saying, I will help you with this, rather than you should really go to counseling for that, because again, that's going to breed defensiveness. So saying, this is something, if you've struggled with something, I've struggled with this as well. I'd be more than happy to help you maybe find something, or even go to a first session with you and be there for you for some support if you need me to, because that can be a really difficult step to take, to be open and vulnerable with somebody that you don't know, right? And really trying to make sure that we're just coming from a place of love and compassion and support, rather than, accusing or belittling. Okay. Can people stabilize a mental illness with just medication? And how do you know if you need medication? So, generally, no, not just having medication is going to be helpful, although it is something that can significantly reduce symptoms. So yes, medication is there for a reason, and we prescribe it for a reason, because it does make changes in people's lives. But generally, the best course of action for treating a mental illness is going to be medication as well as counseling. And so the combination of both of those, we see the best outcome. So I usually encourage people to start with counseling, because there are a lot of things that counseling can do that actually can help rewire your brain and create new chemicals in your brain. And so start there. If after a couple months you recognize that there's not significant progress or changes, then we suggest medication. But usually we want to start with counseling first. And then basically how you can go about getting medication is, if you have a counselor already, asking them for a referral. Or what you can always do is go to your primary care physician first. So primary care physicians do have the ability to prescribe psychiatric medication, although I generally encourage people to not continue to see their primary care physician long term, because just like a specialist, if you had something wrong with any other part of your body and it was consistent and chronic, we would go to a specialist for that. And so that's what psychiatrists do. Are there any resources for family members of individuals with bipolar disorder in the Columbus area, or possibly for siblings? Yes, actually. There are some resources for individuals. There are, like, similarly to like AA is, there are similar support groups for individuals that have a family member struggling with a mental illness. I can't remember exactly all of them off the top of my head, but they do exist. And so I would encourage you to do a little bit of Googling. You can Google some support groups in the Central Ohio area. Everything right now is going to be online, so it's going to be virtual, but there are a lot of groups in the area that are available for some support.
Sorry, I know Mommy is doing one even in the Delaware area that's virtual.
Awesome. Yeah, Al-Anon is good. Al-Anon generally for substance, having somebody in your family that has a substance use disorder, but it can definitely be used for anything. It's just general support for somebody in your family or somebody in your life that is struggling, with any sort of mental illness or substance use. Are most mental illnesses lifelong? Is the focus managing symptoms rather than just expecting a cure? That is a fabulous question, and unfortunately, I don't have one answer. So it really depends on the individual. There are a lot of individuals that struggle with, like, depression, for instance, as an adolescent, and as their brain develops and things change developmentally in general with their body, they often can grow out of that. I don't know if grow out of it is probably not the best wording to use, but can just feel differently. But if you are recognizing that, this is one of those things where somebody's been struggling with a mental illness for years, and it just is not getting better, and they've tried everything, there are definitely instances where people have some mental illnesses that are lifelong. And there are some that have a different like rate of outcome than others. So generally, like anxiety and depression are those that we can like get you to a place where you're seeing significant progress. The prognosis is a little bit better. Something like schizophrenia, that is extremely biologically based. And so that is not a disorder that we are usually curing or, seeing significant progress. It's more about managing those symptoms. So it really just depends on the mental illness. It depends on the individual. It depends on their family history, maybe a history of trauma. So all of that is usually taken into consideration. But I wish there was a straightforward answer. Any other questions? If I'm struggling, how can I get help? What if I don't have insurance? So as I mentioned, and Avery put in my information here, so you can always reach out to me, or the Columbus campus also has counseling. It is free. We do not charge anything. It does not go on your academic record. It does not follow you. It stays, it's confidential. It stays here, and that is up to 10 sessions. And then from there, if you are interested in ongoing counseling, we usually use insurance to determine where you can go. However, I know specifically if you're in the Delaware, Morrill County, or Franklin County, there is sliding fee based on income. So based on how much money you make, you can access services based on a sliding fee of your income. So anywhere from full fee to absolutely nothing. It just depends on person to person. So if you're ever interested, you don't live in Delaware, Morrill County, or Franklin County, and you do feel like you need some support and you don't have insurance, usually check with your local mental health board. They can give you some information on if that is available. Great. Any other questions that we got? See like the bubbles as someone's typing. I feel like I'm texting someone. All right. Okay. So I think we're done. If we have no more questions, then you can feel free to hop off. If you do have any questions and you want to stay on and ask me privately, I am available. I don't have anywhere to be. And if you want to just, email me or call and you have some questions, that is always fine as well. My information is in the chat. So thank you very much, and have a great rest of your day.